hospital pharmacy is a multifaceted career. There are a number of different distinctive components to it. We have the clinical component that most people would be familiar with, whereby the pharmacists will interact directly with other professional staff, doctors or nurses, physios on the wards, or interact with patients. The second would be our dispensary. The dispensary is essentially the repository of drugs in the department. Our dispensary has got 2 robots in it. It has a lot of IT and other technologies in it. And that's where the drugs come to, that's where we do our financials, and that's where the drugs get dispensed from. The other 3 components are medication safety, which is a systematic approach to errors that can occur with regard to the use of drugs in the hospital. So that is work that's done with view to increasing the well-being of patients in the hospital by looking at things that have gone wrong in the past. The fourth area is medicines information, which is an inquiry answering service. So we have pharmacists who man phones and take queries from professional, non-professional staff, and they also generate reports on the optimum use of drugs in the hospital, on like if new diseases are being treated in the hospital, what the best way to do that is. And then the 5th section is the aseptic or sterile compounding area, where we manufacture all of our cancer chemotherapy. That is a very technological area, so not only is it sterile, but we use a state-of-the-art isolator technology. We have electronic prescribing, electronic drug administration components to that, and then there's the compounding in the middle, and there is a clinical element to it because obviously we're interacting with ill cancer patients. The clinical service has a number of individual components to it which have become very specialised in our hospital. We have a transplant service, so that each patient receiving a heart or a lung transplant will be counselled directly by a pharmacist on the best use of the drugs and taught how to take them and when best to take them, and they will be monitored in doing that. We also have a very significant and well-established infectious disease service for HIV positive patients and now for hepatitis C patients who get all the therapies here. And the final area is in the use of antimicrobials, where the pharmacists will keep monitoring on the use of drugs in the hospital for a variety of different infections. So that's essentially the breadth of the services.